There was a patient that came in and with her husband, and they were quite upset because she had had unnecessary surgeries and no one thought of the condition acromegaly. She is actually the person and the reason why I started the support group. I actually ended up talking to her probably once a week. We just went back and forth and I tried to give her support, but I wasn't giving her the support that she needed. What she needed was, and she voiced it, I need to talk to somebody who has it, that understands what I'm going through. That's where our journey started. That's when I started the support group.
I'm Daniel Haché. I'm 48 years old and I'm from Bathurst, New Brunswick. Been married since 2004. 2 kids, 16 and 19, turning 20. I've been coming for the support group. I started last year, 2024, in May. I was diagnosed in December 2023. I went for a doctor appointment. I hurt my knee on the down ski hill, and I tore out a ligament in my knee. So I went to see him for surgery, and he noticed right away that I had big hands. He actually called me back home after. I said, yeah, he said, I noticed that you had big hands. He said, when I signed the picture. He said, yeah, he said, we're gonna send you for blood work. So from that time, I went for blood works and they told me I had acromegaly. But before that, I didn't know.
My name is Janet Cameron. By the 1980s, I definitely had the big hands, wide feet, and the pain as they were just, it was almost like being the Hulk. They would just, I would just go right over the shoes, and these were not cheap shoes. My voice was very deep, the thick tongue, heat intolerance, sleep issues, and extremely painful periods. I would be incapacitated for 3 days.
My name's Steve McCaskill. My age, 61. It's an interesting journey. Looking back now, I see things that somebody should have picked up on or reflected on and understood that I had issues. I was diagnosed quite by mistake. I went to a walk-in clinic, and there was a doctor that was working there. He picked up on it right away. And the first thing he asked me is, have you ever heard of acromegaly? And I'm absolutely not. So he had sent me off to to get tested and whatnot, and lo and behold, here I am.
My name is Pam Schleihoff. I'm 57. I was under investigation for a different medical condition, and so I had a head CT, and so it was an incidental finding that they found the tumor on the pituitary. I got the formal diagnosis in December of 2024. I was relieved to know that it wasn't cancerous, that it was benign, and also grateful that it was found, because like I said, it was an incidental finding. I had a whole slew of symptoms and conditions that I was attributing to so many other things, and come to find out it's actually this. So it was kind of, it answered a lot of, put a lot of things into perspective, and it answered questions that I didn't even know. Like I said, I was blaming it on everything else, right?
My name is Nancy Doan, and I'm 76. So about 1993, after I had been working for a year or so at physiotherapy again, I noticed that my feet were getting bigger. And when I tried to wear a pair of dress shoes with heels, I couldn't wear them because my feet were too big. So I didn't think anything about it. I thought, well, I'm wearing low shoes, I'm back to physiotherapy on my feet all day, and so that was it. So I just went out and bought more shoes. So that didn't work. So after another year or two, those shoes didn't really fit either. So by this time I knew that there was something else going on. So I probably started to have acromegaly in the late 80s. And I wasn't diagnosed until late 2004 or 2005. And I had the surgery in May of 2005. I felt more relief than anything else because finally I had an answer to what was going on.
The first sign that now I know that I do have acromegaly, we got married 2004. I was wearing a 13. I lost my ring in about 2012, and it was getting tight at that time. And we went and bought another one, got it made for the 13, was too small. So we got it expanded to a 15 and a half, still too small. So that's when I should have clicked that there is something wrong.
Dating back quite a few years ago, I'm going to say probably in my 30s. It's funny, I had a pair of my favorite boots, and I went to put them on. Of course, I'd only wear them in the springtime or in the summer, and I went to put them on in the spring, and they no longer fit. And I basically went from size 8 to a size 10, and not aware of what was happening. And so I just lived my life that way. Again, my wedding ring size. I couldn't get it off my finger, I had to cut it off. All of these things didn't add up. I just thought, well, I'm still growing, oddly enough, and oblivious to it. And it wasn't until that I was diagnosed with this that I reflected back and saw all these warning signs that perhaps I should have, myself or somebody else should have picked up on and brought it to attention and try and get some help.
When I started this, before I started this, I could wear a 7.5 to an 8 shoe. And I'm 5'9", so that's not a big size for my height. By the time I finished with all of this, I need to have a 9 to a 9.5 wide in order to have any kind of comfort in my feet. And my hands were also, I probably wore a size 5 ring. And at this point, I'm probably up to a 7.5 or an 8. And I've had to have my rings cut off twice.
I'd say close to 17 years ago. I had noticed, my hands, my rings weren't fitting, and just different symptoms, which I thought was just, normal, right? And then over the years, my feet have grown. I used to always love shoes. Anybody at work knows I was in love with shoes and boots, and they no longer fit. I used to be able to wear anything, and they just weren't comfortable anymore. And I went from a size 7, now it's like a 9, maybe 9.5.
So there's two things with my hands. One is acromegaly, and two, the years I spent in construction, which I think they were large to begin with, but the acromegaly certainly made it that much bigger. I only had my ring size done once, and it is what it is. I get a lot of comments, I get a lot of people staring at them, and it can be uncomfortable, but again, it's the hand I was dealt in life, and deal with it, right?
So when I was diagnosed, it was like it says, how do you feel when you were diagnosed? It was relieved, validated, which was so important, and hopeful that now maybe somebody could do something.
I will say that one thing that has been disappointing for not just me, but for several others of the members of this group is that we have all seen doctors that have not really come up with a diagnosis and then gone back later after we have been diagnosed and have had them say, oh yes, I thought that might be a possibility. Well, I could have been diagnosed probably 3 to 5 years earlier if they had just raised that as a possibility.
One, they know there's something wrong. But then to hear they have acromegaly, what is that? And then to realize that they've had this condition for up to 10 to 15 years, to realize then they've had surgeries unnecessarily done to them, it's heartbreaking.
Before the surgery, yes, I was nervous a bit. But after that, there, when I got to in the room with Dr. Clark there, I was okay, because I knew I was in good hand. Yeah, because when he went on the table, he put his hand on my shoulder, he said, it's gonna be okay. And yeah.
There was relief at having a diagnosis. I didn't have much time to think about it. I only had a couple of months between the diagnosis and the surgery, so that made it a little bit easier. I was a little naive from the point of view that I thought, well, you know, the surgery is not going to take very long and I should be back to work in a week or so, and it was definitely at least 3 weeks before I was back to work. And I ended up not having to have any follow-up treatment until about 3 months later, when they did the blood test and my IGF-1 was going up. And at that time they started me on some Sandostatin, 20 milligrams with an injection once a month.
Well, right now it's been sort of a whirlwind, because like I said, I was diagnosed in December, so there was a lot of testing that I've had to, and a lot of medical appointments. And then I had the surgery middle of March, and then recovery from that. So yeah, it's just been busy. You know, how much, you know, goodness, you know, how much more are my feet gonna grow? How much more is my nose or my head? I mean, I buy a hat and my forehead has grown, and so the hat now is tight and hurts my head. You know, so now having the surgery, my understanding is that now, once they get the growth hormones leveled off, the bones will continue to grow. So,
since I was diagnosed with my surgery, what I see different in life there is, I don't know. It's everything you look at is more beautiful. You look at stuff there, yeah, you said, you don't take life for granted there. You look at stuff, it's hard to explain, but you look at stuff different. Well, all those things I was doing before, like hunting, fishing, and stuff like that, I'm doing the same thing, because I'm the same man.
So how did I feel? I just thought, let's do the best that we can to mitigate the problem that I have, and it's my problem and I'll deal with it. And it's kind of how I look at it.
and I don't know what the future's going to be. I don't know what the plan is moving forward as far as like if other medication. Will I, you know, I'm hopeful that maybe once things are, the growth hormone levels are more normal, would I be able to come off of some of the other medications that I'm taking? Like, I don't know. But I'm hopeful that I'll be feeling so much better than I have in years, and that this time next year it'll be a lot better.
I would say that my overall quality of life is okay, because I make a fairly big effort to keep active. I'm not a big, you know, I'm not into weight training, I'm not into running, I'm not into anything like that, but I try to make an effort to keep active and keep going. And I think that's the difference. I'm not one that can just sit and say, oh, well, that's it, I'm done.
And what would you say to somebody who has acromegaly, has been diagnosed, but what would you tell them to do now? And I said, if you've got the diagnosis, that's the hardest part, really, the hardest. So get yourself to a referral to the endocrine clinic here in Halifax. Be a survivor, not a victim.
It's not gonna go away, for sure. Don't hesitate to get checked, make sure that if you don't have it, great.
My advice to anybody would be, listen to what these experts have to say, seek some advice, and then make an informed decision. And again, my decision to proceed with the operation it is so far, touch wood, it has been successful and I've had no repercussions. It was a little rocky at first, but what isn't?
First thing is that it's not normal if your feet and your hands are growing. It's not normal. Even if you think, oh, I've gained weight, or oh, I'm not, with COVID, you're not going to work, so you're not wearing shoes, so now your feet are getting wider. It's not normal. Talk to your doctor.
If I were to look back there, because we got married in 2004, and my ring was way smaller than what I could have clicked in of what's wrong with me. In the past year, my denture had changed, like my bite denture is not the same, and it's all sign that now I know I have it. It's all sign that I could have took more attention to myself.
If I was to go back to my younger self, I would, say, no, you know your body, you know this isn't normal, and listen to that. And, don't justify or explain things away saying, oh, it's probably just this, or this. Go and actually talk to a medical professional and find out for sure.
What would I say to my younger self? My younger self is not, like we weren't allowed to be heard or whatever, so, and times were different. And I had too many things. I was burning the candle at 3 ends, if that was possible. You gotta demand a second opinion. You gotta believe in yourself and be educated. And because even though people get angry and people get frustrated, the anger only denies you better care and better diagnosis. So, and you gotta enjoy each day. I guess that's what I finally came to believe, is it's one day at a time. And if I ever had a thought back 40 years ago I was going to go through this, I wouldn't have believed it. I really wouldn't have. And would I have coped as well? I don't think so.
Yes, it's important to raise awareness more as much as we can, because I'm sure there's a lot of people out there that do have it that they don't think they have it, like I had. Because in 2023, in November, I didn't know I had it.
Acromegaly needs to become a known disease taught to medical students in university if patients with this insidious disease are ever going to be diagnosed and receive treatment early enough before all the destruction happens in our bodies. Even if just the initial symptoms that you just can't put down to, oh, she's just faking it. I don't make my feet a men's triple-E or my hand size 7 to a size 11 ring. You got to listen and you got to hear people, and the sooner that people can get you diagnosed from just those symptoms, then I think we'll have a chance of an early diagnosis.
Had I had the awareness when I was 30-something, these aches and pains, and pending a successful outcome, the technologies have changed, but these aches and pains that I have today would probably be not as bad as they are, and it would be a little more comfortable.
I had taken some posters to my family doctor and asked them to put it up in their practice in the clinic there, because my doctor, they learn about it in school, but I'm her only patient who's ever had this surgery, who's ever had this diagnosis. And in fact, some of my friends are nurses and doctors, and I've known them for the whole time, and they didn't know either, right? So it is something that we need to be more aware of.
It's just important that we get the awareness out there, and we have done a lot of work, and there's still a lot more to do.
Now, in closing, I want to thank the entire endocrine team, especially Dr. Clark, Dr. Massoud, Dr. Imran, and Lisa Tramble. Without you all, we would not be here tonight. You gave us our lives back, and we are all forever grateful.